Hello, I am Bobbie and here is my mother Terry. I have 3 short videos on YouTube. In my first video, I talk about the medical abuse inflicted on my mother, Terry, while at a publicly funded nursing home in London from June 2007 to January 26, 2012, and also at a hospital in London from January 30th, 2012 to April 23rd of 2012. In the second video, you will see a mini nursing home in my 2-bedroom apartment. I briefly describe the setup, daily routine, exercise, and other suggestions. In the third video, I set out my suggestions for revamping the nursing home environment and hospitals. You are now watching video 1. My mother was medically abused and neglected for 5 years in a publicly funded nursing home in London from June 2007 to January 26 of 2012, and was also medically abused for 3 months in a hospital in London from January 30th to April 23rd, 2012. I have the nursing home medical records and the hospital records to prove the abuse. In May 2007, my mother had been living by herself in an apartment in London. She did not take any pills, but she did have insulin twice daily. She had a bladder operation in May of 2007 and was given 40 milligrams of Lasix, furosemide, a diuretic, for 7 days in the hospital. When she was discharged, she was taken to the nursing home. It was her first day in the nursing home. Abuse number 1. The first negligent doctor at the nursing home ordered 40 milligrams of Lasix daily. I have the medical record from the nursing home to prove it. Right there, furosemide, 20 milligrams twice daily. That's 40 milligrams. Instead of 20 milligrams daily as prescribed by the doctor at the hospital. Here is the discharge summary, and here's what the doctor ordered. 20 milligrams, right there. 20 milligrams daily, not 40. And my mother had a stroke within 2 weeks because of the potassium, because her potassium dropped to 2.5 due to the diuretic. She was confined to a wheelchair due to the stroke. And here's an article from the internet called "Low Potassium Intake Linked to Stroke." And it says, among diuretic users, a risk of stroke was 10 times higher among diuretic users. So she had the stroke. Abuse number 2. When she came from the hospital after her bladder operation, she had 2 nephrostomy tubes that had been inserted into her kidneys temporarily. They were turned off at the nursing home on the first day, and here's the hospital records to prove it. They were actually, on examining the nephrostomy tubes, it was apparent that the stopcocks were turned inappropriately and were actually obstructing the flow of urine as opposed to being on position. She had to be taken to the hospital where it was discovered by a urologist that the switches had been turned off. Abuse number 3. When my mother had the stroke due to the wrong dose of furosemide, the doctor at the hospital gave her orders 80 milligrams of Acefin daily. A total of 79,800 milligrams of Acefin were given to her. And as the second negligent doctor at the nursing home did not check her blood, and she became anemic and palliative, and he couldn't figure out why, a compliance officer ordered the doctor to stop the Acefin. This is the order from the hospital to give her the Acefin, which was fine, but at the nursing home they never monitored it, and they ended up giving her 79,000, and she became palliative. Abuse number 4. The same negligent doctor ordered 600 milligrams of Palifer iron daily from my mother. Here's the medical records for Palifer, 600 a day. My mother started hallucinating and vomited violently. The poison control became involved due to the overdose of Palifer. I was told by the poison control to take her to a hospital. The doctor at the hospital was shocked to learn that my mother had been given 600 milligrams of Palifer. He ordered all iron stopped. Here's the order from the hospital. Stop all iron. I I couldn't bring my mother home because I didn't know how to care for her in a wheelchair, so I took her swimming several times for exercise. And these are pictures of when I took my mother swimming for exercise. Here's in the pool, getting preparing for the pool and going into the pool and actually in the pool. So that was very successful. In 2009, an ulcer developed on the side of her foot to 1 inch in depth. And here is a picture of it on the side of her foot. It's right there. It was 1 inch deep. And after 5 weeks of doing nothing at the nursing home, I finally took her to the hospital, and the doctor there prescribed antibiotics for her, and so I took her back to the hospital, and the doctor said that the ulcer on the side of her foot was healing quite well, but now that she had a little blister on her heel had been in perfect condition. But at the nursing home, they didn't put the little lamb's wool heel caps on her, and so she developed a little blister. The same negligent doctor neglected her foot after took her to the hospital. She was given antibiotics. The same negligent doctor never removed the bandage for 1 month to check her foot. Her foot actually rotted, her heel rotted 7 by 5 by 3 centimeters deep. And here's the heel, which had been normal. It rotted 7 by 5 by 3 centimeters deep. This was all because the negligent doctor at the nursing home never removed the bandage for 1 month. She was actually bathed with her bandage on. And then we have a third negligent doctor at the nursing home. He took over and abused her by continuing to neglect her foot. That was abuse number 8. Abuse number 9 is my mother was dropped into a bathtub. Her whole right side was bruised and swollen, front and back. There was attempted abuse. In February of 2011, the third negligent doctor at the nursing home wanted to put sodium selenite in her eyes for infection. It might have blinded her. I took her to her own ophthalmologist. He said there was no infection. And here is a copy of his prescription: warm water only. Another attempted abuse. The third negligent doctor at the nursing home wanted to give her 15 milliliters of ferrous iron daily. I checked with the College of Physicians and Surgeons. I told the doctor that the dose should never exceed 2.5 milliliters daily for an elderly person. 15 milliliters could have caused hives and a heart attack. This is an article from the College of Physicians and Surgeons where it clearly states that the bottom line, 2.5 milliliters of ferrous daily for an elderly person. Not 15 milliliters, 2.5. So I told the doctor that the dose should never exceed. It would have caused hives and a heart attack. Okay, this happened in 2011. The negligent doctor told me then he could take my power of attorney away. Another attempted abuse. In January of 2012, the director of nursing put my mother into a Broda wheelchair with low sides. There was no seatbelt, even though there was a legal order for a seatbelt. My mother could have easily fallen to her death. Here's a copy of my memo to the director of nursing. The third negligent doctor ordered a hearing with the Consent and Capacity Board for January 27th of 2012. When I heard about the hearing, I removed my mother from the home on January 26th. In a document called The Reasons for the Hearing, composed by the third negligent doctor at the nursing home, the doctor blatantly lied in writing to the Consent and Capacity Board by stating that he had sent my mother by ambulance to a hospital in London on January the 8th of 2012 to have her heel debrided. This is a lie. He did not send my mother anywhere. I took her to the hospital myself on January the 8th. Here is a copy of the bus schedule confirming the date and time that I took her to the hospital, and here is a picture that I took of her right heel at the hospital on January the 8th, 2012, before and after debriding. This is called The Reasons for the Decision, and on page 3 it says here that the nursing home took her to the emergency on January 8th, where she had a debridement procedure of her wound. absolute lie, because I phoned the bus company. I asked them if I could get the schedule, and here's the schedule proving that I actually took her. I took her on January the 8th, passenger number, her name, and what the time that we were picked up and the time that we were returned to the nursing home. And this is a picture of my mother's foot that I took at the hospital on January the 8th. This shows before debridement. This is the condition of her foot after 3 years at the nursing home. This is a picture of her foot after her heel was debrided. So I took her out of the nursing home, obviously. Abuse number 9. When I removed my mother from the nursing home on January 26, 2012, the same negligent doctor did not even give me a prescription for her insulin. As I have stated, my mother was abused every day for 5 years at the nursing home. My mother ended up in a hospital on January 30th, 2012 due to her infected foot. Abuse number 1 at the hospital. The negligent doctor at the hospital prescribed 1,500 milligrams of meropenem and 1,500 milligrams of flagyl, both antibiotics, daily for my mother, a total of 3,000 milligrams of antibiotics. The negligent doctor at the hospital knew or ought to have known that these antibiotics would cause a seizure, but chose to ignore the facts. Here is the article regarding meropenem. It says here, meropenem. Adverse effects, seizures, in big black bold letters. It says right here, all those words that are in bold are life-threatening. He just ignored it. Flagyl, it's the same thing. Flagyl. Adverse side effects. Seizures. Numbness and seizures would develop. Especially, it said monitor especially for seizures. They didn't monitor her for anything. They just ignored her. So she had a seizure and she just slumped in her chair one day when I was there. Even though 2 days before she had the seizure, I had actually given them a note stating that I asked them to stop these antibiotics, otherwise they would kill her. They just ignored me, and instead they asked me to sign a behavior contract stating that I wouldn't ask them anything about any questions about antibiotics. I didn't sign the contract. My mother and as a result of the seizure, my mother has never spoken since the seizure happened due to the antibiotics. The antibiotics also caused my mother to have C. difficile, a very serious intestinal disorder. Abuse number 2 at the hospital. She was kept in a reclining position for 3 months and now has permanent skin damage. I told the negligent doctor at the hospital that I wanted to take my mother home when she was ready to be discharged. I was told that it wouldn't happen and that she had to stay at the hospital until a nursing home became available. The doctors and risk management people threatened my brother, Philip, and I by stating that if we didn't consent to her staying at the hospital, they would contact the Consent and Capacity Board and the Office of the Official Guardian and seize my mother and her estate. We consented. Then I asked them how long would she be at the hospital. They said 6 months. I told them they were committing fraud by taking $2,000 a day from the London taxpayers when I could care for her for $35. I was completely trained and had a hospital bed, sling, and lift at my apartment, and my mother did not have any medical issues at that time. I became frustrated, and in March of 2012 I contacted the media, and my brother Philip and I were interviewed twice on London Today, a radio program. I repeated on the radio that the administrators of the hospital were committing fraud because they insisted on keeping my mother in the hospital when she didn't have any medical issues. I contacted a person at a healthcare agency who listened to me and helped me. My mother was finally discharged into my care on April the 23rd of 2012 and into the wonderful Home First program. Within a short time, the hospital discharged many people into the Home First program, and I have been told that the Home First program actually saved the government $21 million. And here is an article from London Free Press. It's called Home is Where She Wants to Be. And coincidentally, it just said that since March of 2012, the number of beds used by patients has dropped 21%. I wonder why. I think it had to do with the media. Then I finally realized that the hospital wanted to keep my mother in order to raise money for the hospital, a low-maintenance fundraiser. Now my mother is checked weekly. Her blood pressure, pulse, oxygen, sugar, and her chest are all normal. She does not take any pills, only a few vitamins. She does not have diabetes due to being on a plant-based diet, and her foot is completely healed. Her hemoglobin is 133. She has wonderful care by very skilled personal support workers. My mother and I are both enjoying success on a plant-based diet. I completed a course entitled Complete Health Improvement Project that you can check on the internet. It is taught in many countries. We do not eat any meat or dairy products, and here's a copy of my certificate of completion. And actually, here's an apron too. It's called Complete Health Improvement Project, CHIP for short. Wonderful, wonderful course, lifestyle. If my mother and I had never encountered the 3 negligent doctors at the nursing home and the negligent doctor at the hospital, my mother would be walking and talking today. I hope that you check all pills prescribed to your relatives in a nursing home or hospital. Many doctors in nursing homes prescribe 60 to 70 pills daily to a resident, almost 24,000 yearly. There is no person on planet Earth who needs 60 to 70 pills daily. I discovered in the book entitled Compendium of Pharmaceuticals that the dose is shown for the infant, child, teenager, and adult, but there is no dose for the elderly. Many doctors are prescribing the adult dose to an elderly patient without searching for the elderly dose, and in many cases the negligence could easily cause hives, heart attack, congestive heart failure, and death. Check my next 2 videos, How to Care for a Person from a Nursing Home, and my suggestion for revamping the nursing home and hospital care system. I hope I have enlightened you, and I wish you Merry Christmas and Happy Holidays from my mother Terry and myself, Bobbie.